morning, everyone. We're going to get started in a few minutes. My name is Zareen Ahmed. I am the Senior Policy Analyst at FPWA, and I am also the project lead on the Ending the Benefits Cliff Symposium and the work that we're doing around that. I'm so glad that you're all here, and I really appreciate you all being here. So first, we're going to hear from Jennifer Jones Austin. She is the CEO and Executive Director of FPWA. So take it away, Jennifer.
Now, hopefully, I'm unmuted and you can hear me. I want to welcome you all to FPWA's Ending the Benefits Cliff Symposium, a two-day gathering focused on both understanding and upending, undoing, bringing an end to the benefits cliff here in New York, which has long challenged so many New Yorkers in getting ahead and achieving true sustainable economic security. FPWA, for those of you who don't know us, is an anti-poverty, social policy, and advocacy organization. We have more than 170 nonprofit human service agencies and faith-based organizations as members and partners in this work. We also partner with other advocacy groups, with policy influencers, and at times we partner with government to help alleviate the burdens of poverty for people here in New York, and dare I say, work towards the actual eradication of poverty for people here in New York. We know the statistics. We know that according to the self-sufficiency standard, better than 40% of New Yorkers have a hard time making ends meet. And we know that the social safety net for those persons plays a critical role in helping them to put food on the table, to take care of their children when it comes to childcare, and take care of basic needs related to food supports for babies, the Women, Infants, and Children program. We know that it ties into the Earned Income Tax Credit and helps people keep money in their pockets when working. With COVID and the impact that it has had on the lowest income persons here in New York, many of them Black and brown persons, great majority Black and brown persons, when it comes to being devastated, we know that we've seen significant job loss. And the greatest loss has come in those communities. Those communities where people were making the lowest wages to begin with, and now with COVID job loss, they're going without all the more. Well, we know that the importance of the benefits of income supports and benefits is made even greater by COVID and is further challenged by COVID, because as people start to get back to work, they're going to have to rebuild. And if there is the risk out there that every time they get a job and they earn another $1 or another $2 in increased raises, that there is a threat to their child care or a threat to their SNAP benefit, a threat to their EITC that they draw down, then they're not really going to get ahead. And we're concerned about not just making sure that people get by from day to day, but they actually get ahead. And so what we're going to be doing during this symposium is making sure that we all have a clear understanding of what the benefits cliff is. And then we're going to be talking about what are the possible solutions at the policy level and at the legislation level to make sure that people get the support that they need to get ahead, not just get by, but get ahead. This is all part of FPWA's theory of change, where we understand and we believe that if we really are going to work with our neighbors and our friends and our communities to achieve true economic security for everybody, it can't just be by helping them get along. We have to look at what are these equity pillars: education, housing, wages, jobs, asset development, and health, mental health. Also, making sure that we look at the barriers that have long persisted that have prevented people from getting ahead. Racial equity being a significant issue that we have to attend to. But we know that in order to do that, we have to make sure that this benefits cliff that has long been in place is done away with. So this symposium is the beginning of that work. We're so thankful, we're so glad that you're joining us for this. We're looking forward to sharing with you and in turn, hearing your thoughts about what we can do to bring an end to the benefits cliff here in New York, and also then allow other states and jurisdictions to learn from this work. So again, I thank you. I welcome you into this conversation, and I look forward to learning from you. Zorin?
Thank you so much, Jennifer, for those words. So we're going to get started. Again, thank you all so much for joining us. And we're going to kind of take care of some housekeeping first and go through the agenda and kind of how we're going to be using Zoom for today at least. Welcome everyone. Today we're going to have a pretty quick agenda. We're going to, we are currently welcoming and opening all of you. And then we're going to hear from Emily Miles, who is our Chief Program and Policy Officer, about the Ending the Benefits Cliff project and our goals for the symposium. And then we'll do an overview of key benefits issues from Ashley Garner, who is our policy associate at FPWA. And then we'll go into an overview of the self-sufficiency standard and the benefits cliff in New York. And the self-sufficiency standard is a really critical aspect of how we're looking at the work that we're doing. And that will be a presentation from Diana Pierce from the University of Washington, who we've partnered with to do some of the research. And then we'll close out with a review of day 2's materials and agenda and close out for the day. Next slide, please. So before we begin, a few notes on Zoom. We've actually had to disable video and audio for the duration of the presentation, just given the size of the group. If you do have any questions, please use the question and answer function, which I'll get into in just a moment. We'll try to address questions when we come to stopping points during presentations, if possible, or at the end when if we have a few minutes to end early. Any questions that we think would be better answered tomorrow in the breakout sessions, we'll go ahead and bank those questions for the next day. And again, please take breaks as you need them. We definitely want everyone to feel rested and take care of their needs as well. Next slide, please. We'll be using the question and answer option. And so if you go to the bottom of your screen and you see the Q&A function, you can go ahead and type in any questions you might have at any point of the 2 hours that we're together. And if you ask a question in the question and answer option, you might either receive a written answer in the Q&A box from some of the folks who are monitoring that, or you'll be notified that one of the presenters will be answering your question live. So I think that's a pretty nifty tool. Next slide, please. And then we'll definitely, at least have one poll for everyone, but this is kind of just what it'll look like. So if you see a poll on your screen, feel free to answer it, submit your answer, and then we'll share the results of the poll as well. Next slide. And then obviously you can use the chat function, which I'm sure so many of you are familiar with, but feel free to, chat us and let us know if there's something that you are concerned about or just want to bring to our attention, and we'll absolutely get to that. And next slide, please. And so, unfortunately, since we're not able to see you all and hear you all today, but we will tomorrow, but for today, in the chat function, if you can, please go ahead and introduce yourself, provide your name, organization, and pronouns, and then answer one of the following prompts. Either what interested you in the Benefits Cliff Symposium, what you're hoping to get out of the symposium, or what questions you might have about the benefits cliffs that you're bringing here today or for tomorrow's discussion. And if you use the Q&A function for that, kudos to you as well. So if folks could take a few seconds to go ahead and do that. I know some of us don't love icebreakers or introductions, but we'd still love to kind of get to know you all as well. Just gonna wait a few seconds. Don't be shy, y'all. Thank you so much, Heather. Yes, that's awesome. Hi, Karen. Thank you so much for being here today. Hi, Courtney. Hi, everyone. Thank you all so much. Someone said to listen and learn about what New York is doing and potentially share ideas and options with other states. That's awesome. Gaining information about the benefits cliff and EITC. We've got a really amazing group of people, and I'm so appreciative that all of you are here. Um, we'll definitely have time tomorrow to really have more interaction, and so I'm really hoping that we'll have an opportunity through this symposium to really get to know all of each other. Hello, Senator Frizzou. Thank you so much for joining us. Wow, just so much knowledge and so much experience here. So I'm really excited to hear from all of you tomorrow. Great. So I'm going to go ahead and pass it over to Emily Miles, who is our Chief Program and Policy Officer, and she will take us through what the Benefits Cliffs project is and what we're trying to get out of it. Thank you all so much.
Wonderful. Good morning, everybody. Thank you so much for joining us this morning. This is a very exciting morning for FPWA. As you can tell by my background, FPWA screaming behind me. We are so excited to have all of you here. This has been a long time coming. We originally planned for this convening to take place in person, and so normally under what we had planned for this scenario, I'd be looking at a sea of your smiling faces, energized for the day to talk about real solutions to how to address the benefits cliff in New York State. So this is a bit of a shift for us doing it virtually. And so first of all, we just want to thank you and we appreciate your patience as we navigate this new virtual space. But I also just want to take a moment very quickly to thank some of the staff that you are going to be interacting with today. So first, I just want to give a quick thank you to our Executive Director and CEO, Jennifer Jones-Austin, who you've already heard from this morning. Under her leadership, FPWA has been allowed to investigate this issue and really dive in here, and we really appreciate her support. Secondly, Jeanette Estima, our Director of Policy, Zareen Ahmed, who you just met, our Senior Policy Analyst, and Ashley Gardner, without which their work on this issue, we would not be where we are right now. So thank you so much, and you will have an opportunity to meet them and interact with them over the course of the next 2 days. Next slide. So we're going to start quickly with a poll. We're going to try to be as interactive as possible over the next 2 days to keep everyone engaged. So if we could launch the poll, we want to know a little bit more about where you are right now in your knowledge of the benefits cliff. Is this a new topic to you? Is this something that you've heard of? You have a sense of it a little bit, but you're not entirely sure of the ins and outs? Are you a little bit on more solid ground? You have a really good sense of what it is and how it impacts clients, but maybe not so much in New York State? Or are you an expert? Are you coming here with us today to dive into these recommendations and help guide us as we move through this work? So if you can go ahead and begin answering that poll now, we'll give everyone just a couple seconds, and then we'll share those results with everyone. Okay, so we are sharing the results now, and we have a pretty good spread. We have some folks new to the idea. We have most of you are about the middle. You've heard of it, you have a bit of a sense, but you are here to gain additional information. And then several experts who we will be leaning on throughout the next 2 days to help us as we guide our conversations. Thank you for that. So to ensure that we are all at the same place as we jump into these conversations, we wanted to just quickly level set and make sure that those of us who are new to this conversation have a sense of what we're talking about here today. So we're going to start with some basic definitions. So what are benefits cliffs? What is this concept that we're here to talk about? And so we have a working definition on the screen for you. As benefits rise, cliff occurs when higher pay triggers a sudden loss of public benefits for a low-income worker, resulting in a net loss of income. So benefit cliffs are frequently seen. Benefits that are impacted by this are frequently public assistance, rent subsidies, childcare subsidies, SNAP and Medicaid are also impacted. And what we find in this is that individuals will frequently make decisions for themselves or their professional lives that are a reflection of a fear of the loss of these benefits, because these benefits have real economic value, especially in New York City and New York State when we talk about childcare and housing subsidies. These have tremendous economic value, and so the fear and the reality of possibly losing those, especially when for many it takes months, sometimes years to actually gain access to those subsidies, is enough to frequently dissuade people from taking advantage of wage increases or increase in hours. Alternatively, we also have individuals, as individuals lose employment or wages can stagnate or decline, gaps in benefit coverage and bureaucratic barriers become more pronounced. And while this is not a cliff, it's important to acknowledge the context of this because it does create a gap for families and it does destabilize them. And so in our project, we are discussing the benefits cliff. We're trying to work out how we can smooth those slopes so that folks that are receiving benefits are slowly weaned off of them. But alternatively, we want to make sure that those who need assistance have access to them and that those benefits are proportionate to the need that they have. Next slide. So why now? Why are we bringing everyone together now? So if you had asked me that question a year ago, I would have had a very different answer than what I have today. So originally, we were coming together because several years ago, New York State took a huge step forward and increased its minimum wage to $15 an hour in New York City and the surrounding counties, and then to $12.50 in upstate New York. And that was a huge increase for low-income New Yorkers and had profound impacts on their economic well-being. Unfortunately, throughout the campaign, the Fight for 15 campaign, that was the campaign that was successful in advancing the $15, there were many conversations that were happening behind the scenes with advocates about what the impact of that $15 increase would be on the benefits that many low-income New Yorkers are receiving. But we didn't want to make too much of a fuss about it at the time. There was already a steep hill to climb in trying to achieve the $15. And so we kind of put a pin in that conversation in order to come back to it afterwards. The $15 was achieved. There has been a slow increase in the wages to that $15 over the past several years, just finally reaching that $15 wage recently. And the time is now right for us to come back and have that conversation. Again, a year ago, we were in a very different economic situation than we are in now. Wages were rising, unemployment rates were relatively low. And so focusing on the cliff and people transitioning off of benefits was an important conversation to have. Unfortunately, the world looks very different now than it did a year ago, because now we are in a we can say post-COVID, although we are unfortunately still very much in it. We are in a COVID world, and we are seeing the economic ramifications of the global pandemic. And so whereas before we were seeing wages rising, we were seeing a leveling off or a decline of unemployment rates, that is very different now. We are seeing record level of unemployment rates. We are seeing many are proposing to be a drawn-out economic downturn. Some are even saying we're entering into a depression. And with this shift in the economic future of New York City, state, and the country, the question is arising about these benefit programs. Are folks going to be able to access them the way that they need to as their economic needs increase? And though we are seeing increased folks that are applying for these programs, we have seen in previous recessions that some of these benefits programs are not as they do not shift and they are not as accessible to many of these populations as they should be. And that has to be part of the conversation. Next slide. So we have three main goals of this convening and then the ensuing work. The first is that we're convening experts to create a policy roadmap to end the benefits cliff in New York. And that's where we are right now. We have convened an advisory committee of leading experts in New York City and state and nationally to come together to help guide the creation of both this convening and the recommendations that we are going to be responding to in the upcoming days. We're consulting experts that are with us today in the crafting of those recommendations. And we are hoping that through this work, we will be able to create recommendations that will be reflective of the needs of the community. Next slide. You'll see here a list of our advisory committee members. And again, just want to extend our deep, deep thanks to each of them. They have been incredibly committed throughout the last several months in helping to guide our thinking, to advance our thinking, and to plan for today. You will have the opportunity to also interact with a number of these advisory committee members over the next 2 days, especially tomorrow when we go to breakout groups and really dive into those recommendations. So thank you again to each of you. Next slide. So goal 2, to prepare and publish a report addressing the benefits cliff issues. So we are going to be utilizing the research we have done to prepare for this convening, the recommendations that we are going to be crafting together, and the analysis that we are currently undergoing in conjunction with the Center for Women's Welfare at the University of Washington to create a report to outline the roadmap for addressing the benefits cliff in New York State that will have recommendations at the national level as well, and work will be echoed at that level, hopefully in conjunction with all of you. Next slide. And then finally, we are going to be conducting a broad public and key stakeholder awareness and education campaign to support the changes that we hope to see. We are going to be launching this advocacy campaign in early 2021. Again, that was supposed to be a live event that we were very excited about. It will likely now be a virtual event that we are also still very excited about. And more information will be coming to you in the upcoming months. We, of course, hope to see all of your faces there again for that event. And we hope that you will join us for the advocacy campaign in New York State, but also with the federal asks as well. Additionally, it's very important for us to not only have voices of experts and of providers. You will see as you scroll through the participant list today, a number of thought leaders from policy think tanks, from government, from service providers, but also it's important for us to have the voices of those who are personally impacted by the benefits cliff, those who are receiving benefits or who have received benefits, who can tell their stories and really outline the impact of the cliff, the loss of benefits, and the lack of access to benefits and the impact that has not only on themselves, their families, but their communities as a whole as well. And so we are going to be undertaking participatory research over the course of the next couple months, and we'll also be including those voices and those leaders in our campaign that is going to be launching next year as well. We're very excited to have those voices joining us today and to be working with us over the course of the next couple of months to ensure that our campaign is responsive to the people who need it the most. Next slide. So finally, several outcomes that we're hoping to achieve over the next 2 days. I'm not going to read each of them to you. You can see them on your screen. These slides will be available after the presentation, so we'll make sure you have these. But again, we want to revive the conversation about the benefits cliff, new ideas for recommendations. We're hoping that you will join us in some of the work as we launch our campaign next year. And we also hope that you'll be able to connect with each other, that you'll be building some relationships with each other, and that you'll be able to carry those beyond this convening. Without further ado, I'm going to turn it back to Zareen, who will take us to our next portion of our morning.
Hi, everyone. So we have minutes for questions if you have questions for Emily and the slides that she's kind of gone through. So feel free to go ahead and send us questions if you have any at this moment. We've got about five or 6 minutes for questions if needed. We're just going to wait for questions to roll in. And you can use the Q&A function and you can use the chat function as well.
I see a question from Michelle Knox about how can we work to turn the benefits cliff into slope benefits off-ramp. That is exactly the question that we are hoping to answer in the next 2 days, especially tomorrow in our breakout sessions. So again, for too many of those who are receiving benefits, those drop off immediately. There's not, you know, when we're talking about childcare subsidies, you either have it or you don't currently. There is not a sloped decline in access to that resource. We are hoping to shift to that. That might not be possible with every benefit because there are federal rules, there are state rules that we're hoping to also shift, but there are other types of possible remedies that we can look at, not only in creating those slope benefits, but what are other supports that we can create in order to provide economic relief to these individuals and families. And that's where a conversation is going to be happening tomorrow about eligibility, about tax credits, about the role of employers, the role of public education. This is not just, this is not an issue that will solely be solved in just changing the benefit structure. There need to be other supports around these individuals and families as well in order to really address the needs. And that's what we've been hearing from folks in the field as well.
Thank you, Emily. We will have time at the end for more questions if people have them, but we're gonna go ahead and move on to hear from Ashley Garner, who is FPWA's policy associate, and she'll kind of talk about the work that we've been doing thus far. Thank you, Ashley.
Of course. Good morning, everyone. So as Zareen stated, I'll be walking us through the benefits landscape in New York City and New York State as we know of it right now. And so before I begin, I just want to reinforce that FPWA is not the expert in the issue of the public benefits and the safety net, right? Like, although we can certainly aspire to be and hope to be after a few years of working pretty ardently on the benefits cliff issue, right now our main goal is to serve as conveners, right? And so the information that I'm going to be presenting is largely based on our review of the literature and informed by the conversations that we've had with our advisory committee and within our own network. In this space, we want to acknowledge and lift up that many of you all are the experts, right? And we'll be turning to you throughout this process to help us further round out and continue to lift up these issues. And the last reminder, just before I get started, is in regard to Q&A. So like Zareen stated, at any point in time, please feel free to pop a question into the Q&A function or the chat. My presentation will be largely a springboard for the breakout sessions for tomorrow. So there isn't really a Q&A time allocated for this presentation, but if you do put them into the Q&A function, then we will certainly discuss them in the individual breakout groups tomorrow. Alrighty, next slide, please. So there are several challenges associated with addressing the benefits cliff, and the largest of which is the fact that the issue is just really complex, right? So public benefits, as you all know, they flow through a maze of federal, state, and local funding streams. Many of those are interconnected. Some are not connected at all, like offices don't talk to each other, they're decentralized, even on the local level, right? You can have your Medicare office not talking to folks who are doing SNAP benefits. And so there's a lot of complexity that creates a challenge for understanding where benefits cliffs exist exactly. And just another example, I mean, when you think about tax credits, right? In New York City, at least, you have the federal EITC, you have the state EITC, and then New York City has its own EITC supplement. And a lot of those have different eligibility rules and requirements. The second challenge is that cliffs are not static, so they vary a great deal for individuals and families based on their family type, the size of their family, what state they live in, and other sort of very specific demographic factors. And this level of variation can make it really difficult to map the cliffs and understand the scale of their impact. Thank you, Alex. Yes, EITC is their earned income tax credit, my apologies. And within all of these challenges, they create, the complexity of the system creates several financial gaps. Next slide, please. And financial gaps were coined by the Center on Social Policy at UMass Boston. And what financial gaps refer to are specific problems created by the complex system of public supports built around an inadequate assessment of ability to meet basic needs, right? So basically that our safety net is not fully serving the amount of individuals and families who need support. And so under financial gaps, underneath this umbrella, there are 3 gaps. The first is the eligibility gap. And the eligibility gap occurs when family earnings rise above eligibility thresholds while still being too low to meet basic needs, right? So program cutoffs have, let's say, 130% of the federal poverty line. An eligibility gap is that family who has 135% of the federal poverty line as their income. Still not enough by any means to meaningfully make ends meet, but too high to qualify for the programs. The second gap is the coverage gap, and that refers to families who qualify for public benefits, but do not receive them due to wait lists, supply shortages, or just other administrative and bureaucratic barriers. So the most common example here that springs to mind is one of housing vouchers, right? And so for those of you working in sort of the housing space, you're very familiar with the fact that our housing stock does not at all meet the need. And so this is a coverage gap. And finally, the hardship gap refers to when family resources, including the receipt of public benefits, are still too low to meet basic needs. And so this gap is actually often the result of benefits cliffs, right? And so as families are seeking to increase their incomes and to fill the gap, they end up losing benefits significantly or altogether, and then that will create a hardship gap. And so while the hardship gap is most often associated with benefits cliffs, understanding coverage and eligibility gaps are more like our roadmap, right? They show us where to look for potential cliffs and kinks in our safety net and let us know where we might be starting to frame some of our interventions. And so as we continue, you'll see that we talk a lot about the eligibility gap, a lot about the coverage gap, right? And sort of this broader picture that we have of what the benefits cliffs are and where they exist. Next slide, please. Another challenge with addressing the benefits cliffs is the problem of perception. And so just first and foremost, cliffs obviously challenge our collective understandings of fairness, right? And how benefits should work. If you have an individual or a family that's turning to the safety net for support, there's sort of a cognitive dissonance there that they could walk away from that system feeling in a sort of a more economically strained or squeezed position. And programs that lead to self-sufficiency shouldn't be contributing to worse outcomes because of increased earnings. So that's one major problem of a perception, right? And the second issue is that cliffs are often used as evidence that the safety net programs are poverty traps. And we want to be sure that when we're talking about the benefits cliffs, that we don't fall into this sort of language, right? Poverty traps meaning that the safety net, namely benefits cliffs, create a situation where folks using benefits are unable to move off of the safety net due to policy design failures. And so the central argument here is that benefits don't work, right? We can scrap the safety net altogether or call for some pretty major and drastic reforms. And obviously, that's not to say that our safety net is without the need for major reforms. That's why we're convening. But the belief that the safety net does not work is a fallacy, right? Overwhelming research shows that the safety net does work. It pulls families out of poverty, and it can lead to more positive life outcomes, particularly for children who are within families who are receiving benefits. And the evidence used to make these arguments is often a bit misleading, right? So they might, studies that make this claim that the safety net is a poverty trap might use all benefits programs as a part of their calculations, which maybe doesn't match the benefits reality, or another host of issues that sort of can create this this poverty trap rhetoric. And so it's something that we want to be sure to avoid. Of course, the safety net has areas that are ripe for intervention, but we want to acknowledge where it is working. And so from the benefit recipient side, in terms of the issue of perception, there's an issue with folks not understanding and having a difficulty understanding where cliffs exist within their own benefits picture. And so like what we talked about earlier with the notion of complexity, can be really difficult for an individual or a family to understand where cliffs might present. And there's a lot of sort of not factual conversation that might be happening within communities about what benefits cliffs means and where they are. And so, you know, it's important that we lift up the idea that people often fear cliffs that might actually not be manifesting, right? And so even in cases where cliffs might not be present, the perception that there are cliffs may still lead to negative impacts on families who are making decisions about hours, wages, and other opportunities based on infactual information, right? So based on the belief that they're going to hit a cliff that may or may not exist. And so what the issue of perception is really lifting up for us is that there has to be a better way to make sure that our communities are all on the same page about what the benefits cliffs are and where they exist and what their impact can be. Next slide, please. So with all that said, with all the challenges and the complexity, how should we begin to start thinking about addressing the cliffs? And there are a slew of proposals to reduce cliffs without increasing harm. The first of which being increasing income eligibility limits so that people who are eligible for safety net programs, so that more people are eligible for safety net programs, rather making programs universal, implementing or expanding gradual benefits phase out periods, like the question that we received earlier, or allowing people to keep benefits from a previous, allowing people to keep public benefits while they start a new job, right? Just to give them time to sort of stabilize. Of course, many of these proposals are really dependent upon political will, right? So universalizing programs will incur a hefty price tag, though not as great as the social cost of poverty. But you know, we want to keep those sort of things in mind when we're designing program recommendations, and inroads towards addressing the benefits cliff is what the political appetite might be, and still push it, of course, a little bit, but you know, keeping those things in mind. And New York has implemented many of these strategies that I've gone over, but there is still a lot more that can be done. So next slide, please. Well, next two slides. Now we're gonna be talking about benefits in New York State. The next slide, please. So in this section, what I'm going to be walking you all through is sort of the major benefits areas that we found in the literature, those that were sort of most salient when we're thinking about benefits cliffs, but also when we're thinking about the impact that they have on families, so their ability to sort of stabilize families, and the benefits programs that come out sort of head and shoulders above many others in terms of the stability that they're able to provide for families were always Medicaid, SNAP, and childcare subsidies. And so those are the three that I'm going to talk about a bit briefly. And so the first is Medicaid. And so here I'm going to just go over where the common cliff is within the program, a common recommendation that comes out from the literature based on sort of the common assessment of problems and whether or not that common recommendation is applicable in New York. And so for Medicaid, prior to the Affordable Care Act, Medicaid eligibility for adults was limited to those with dependent children who earned very little income. Right, so the Affordable Care Act greatly diminished the Medicaid cliff effect by allowing states to expand Medicaid to all adults with incomes less than 130% of the federal poverty line, right? And that's regardless of whether or not they had dependent children. And so the common recommendation that still exists around the Medicaid cliff effect is particularly in states where they did not adopt the Affordable Care Act Medicaid expansion, right? And so there are 19 states that have not done this. New York is not one of them. And so the common recommendation would be to mandate or incentivize those remaining 19 states who have not adopted the Affordable Care Act expansion to do so. But like I said, New York State has adopted the Medicaid expansion. And research has shown that adults who live in expansion states experience little or no Medicaid cliffs, since they are eligible for Medicaid while earning low wages, and then become eligible for tax credits to purchase insurance gradually as their incomes rise. Next slide, please. And so the next benefit we're going to talk about is child care subsidies. And so in 2014, Congress reauthorized the federal child care and development block grant. And what this did was required all states to adopt policies that reduce sharp cliff effects and provide kids with stable care as family earnings fluctuate. And just to sort of pull over a bit here, why might family earnings be fluctuating? Because I think this point is really critical when understanding the benefits cliffs, that a lot of our low-wage families, right, their hours might fluctuate or shift. Maybe they have to take time off because, you know, they're sick or a child is sick. And so what benefits do and do really well is keep income stabilized to sort of safeguard against those types of day-to-day fluctuations. And so all states are required now, as of 2014, to offer 12 months of continuous coverage to children receiving child care assistance. At the end of the 12 months, states must ease families who are no longer eligible off of subsidies, right? So if at the end of 12 months, the fluctuations have stopped and you're still within eligibility, you will continue on receiving your child care subsidies. But if at the end of the 12 months, your income is now firmly above the eligibility threshold for child care subsidies, as of 2014, the state is technically required to still provide a period within which they begin easing families off the subsidies. So it's not that they lose it after the 12 months either. An issue here is that the 2014 reauthorization gave states the option to prevent working parents from losing their subsidy. And because it is an option, right, many states set income eligibility limits for their child care subsidies well below the federal income ceiling, and mainly due to insufficient resources to fund these subsidies. So while this off-ramp is in place, technically, it is woefully underfunded. And what would typically occur in this situation is that states would just be giving out less childcare subsidies. So rather than meeting the full need, again, right, that's that coverage gap. So rather than meeting the full need within their state, they lowered their threshold for eligibility so that they did not have to provide that much more allocation and funding towards this program. So the common recommendation that exists here is related to that last point, right? Provide federal funding to fully realize the above mandate. In the absence of increased funding, like I stated, states will likely decrease the number of childcare subsidies they offer to offset the increased costs associated with providing that off-ramp, right? And so here, this recommendation is New York State applicable and New York City applicable because we do need to increase funding to ensure that this off-ramp is meeting the need that exists within the state. Next slide, please. Okay, and so finally, I'm going to be talking a bit about SNAP. And so the cliff effect, the SNAP cliff effect exists due to a federal rule that cuts off benefits at a gross income of 130% of the federal poverty line. And so for a family of three, that's roughly $26,000 a year. So a family that is close to this level, who also has large deductions for housing and childcare subsidies, could experience a loss in benefits that is greater than their earnings increase, right? So a benefits cliff. But what states have done to sort of intervene for the SNAP cliff effect is rely on something called broad-based categorical eligibility. And what broad-based categorical eligibility allows for is states to increase the gross income limits. And so with this option, SNAP benefits can phase down to nearly zero as a family's income level increases prior to reaching the state income limit. And so just to give an example with numbers to make it a little bit more tangible, and I believe that this is from Ohio. Ohio also has broad-based categorical eligibility implemented. And so, and they have theirs set at 300% of the federal poverty line. So as a family reaches, so that the family enters SNAP at 125% of the federal poverty line, and as their income continues to rise, now they're 135%, let's say, right? They're not automatically dropped from SNAP. just the amount that they receive in SNAP benefits will gradually begin to lessen in tandem as their income is rising. And that sort of slope in that dance will continue until their SNAP benefits phase down to almost zero. And they will hit that phase down prior to them hitting they'll likely hit that phase down prior to them hitting the broad-based categorical eligibility threshold. So the common recommendation that exists here is to implement, or as of this presidency, to safeguard broad-based categorical eligibility. And so many of you might remember in 2019, there was a proposed rule change to get rid of broad-based categorical eligibility. And I'm sure many of your organizations put out statements fighting against that. And we were able to avoid that for now. So New York has adopted broad-based categorical eligibility for SNAP. And unfortunately, I don't know the top percentage, right? So like in Ohio, I said it was 300%. And we'll get to why that's an issue in a few moments on a different slide. But just to recap, for New York State applicability, New York has adopted BVCE, and SNAP benefits in the state do phase down gradually as a household incomes rises. Okay, next slide, please. And so in this final section, in my last few minutes of the presentation, what I'm going to walk you through is just based on our understanding of where New York State has already addressed some common issues, where we might want to start looking to push our policies even further to close any gaps, right? And so even though I stated that, New York State has already implemented broad-based categorical eligibility, they've already implemented, the Affordable Care Act expansion, there is still the momentum of our current moment that we should be able to harness to sort of push New York further. As many of you stated in the chat, you work with clients or you have experienced yourself benefits cliffs. And so that means that New York State, New York City is obviously far from perfect. Okay, next slide, please. And so our first focus area, and we have 4, and this is what our breakout sessions tomorrow will be organized around, is around the role of employers. And so I'm not going to read these for you, but I'll just sort of briefly restate. And so what we're interested in here under our focus area of the role of employers is how we might motivate employers to intervene critically to reduce the severity of cliffs for their employees. And then I'll just do a brief pause after each in case you do want to read them. I know everyone learns differently. Okay, next slide, please. All right, and the second is a focused area is on asset building and asset limits. And what this breakout session and what this focus area sort of will be asking is how our current system discourages or hampers the ability to amass needed assets like emergency savings. And so in a lot of our programs, right, there exists asset limits. So how many assets folks can have. And in order to get the help that families and individuals need from the safety net, they're put in a position where they might be asked to spend down their benefits, spend down their assets, or if they're not in that position, if they don't have that many assets amassed anyway, it leaves them in a position where they're unable to begin amassing assets. And again, like I said, for emergency savings, there are a whole host of reasons why we, of course, link the ability to build assets as central to reducing the severity of the benefits cliffs. Next slide, please. All right. And so this focus area is public education. And what we'll be asking here is how do we best ensure that individuals and families in need have the quality tools and resources necessary to make informed decisions about benefits cliffs. I saw from a number of folks in the chats, you are working at an organization who's working on a benefits cliff calculator or developing one in partnership with other organizations. And those types of resources, among a few others, are exactly what we're going to be talking about in the public education focus area sessions, as well as how we deal with perception, those problems that I talked about earlier. And the last slide, please. Okay, and finally, the final focus area is eligibility for benefits and tax credits. And what we'll be asking here is what opportunities exist to simplify the eligibility process, right? And this is the example that I had mentioned earlier when talking about SNAP. So I fancy myself a pretty good researcher, and try as I might, I couldn't find that upper limit for New York's broad-based categorical eligibility. And so in looking in the New York Gov webpage, one sentence that I pulled out was, but the only way to determine if your household is eligible for SNAP benefits is to apply, right? And while the sentiment there is wonderful, that can be really confusing and challenging for families who are strapped for time, strapped for resources, right? And really eligibility should be a lot more transparent than it currently is. So that's an eligibility problem, right? This focus area will be thinking about where eligibility might be expanded, and who we might be capturing in addition with those expansions. Okay, and so that is the end of my presentation. Again, unfortunately, there isn't time for questions at the end of mine. I know that it was a bit content heavy, so please do take some time to mull over what we've talked about, put any questions that you have in the chat or the Q&A function, and again, we will spend a lot of time going over all of these issues on a pretty granular level in our breakout sessions tomorrow. Okay, and with that said, I'm going to transition us back over to Zareen for our next speaker. Thank you, everyone.
Hi, everyone. Thank you so much, Ashley. We are now hear from Ann Pierce, who is at the University of Washington. She does in that arena. Please continue to send us questions. We will answer them as they come up to the extent possible. I'm going to go ahead and answer Rose's question from earlier. Will there be any discussion about applying for public assistance and welfare and making that process easier and less demeaning to applicants? It's a totally very important aspect of the experience of applying for public assistance. We highly encourage you to participate in one of the breakout sessions tomorrow, and bring that, and we can try to bring that in as part of the discussion. I just can't emphasize how much of an important concept that is. I think in public education is where we might have some of that discussion, but yeah, we are, it's definitely something that is concerning in this landscape. Thank you for that question, Rose. I'm happy to take other questions if folks have them at this moment. Yes, so thank you for that question, Rose. The breakout groups will be happening tomorrow from 9 a.m. to 12 p.m. We will be sending out a attendant survey for you all to fill out so that you can choose the breakout session that you would like to attend. So that will be the 4 focus areas that Ashley had laid out. So that will be eligibility for benefits and tax credits, public education, the role of employers, and asset building and limits. And so we will be sending out the link to take the pre-survey. We really, really, really highly recommend that you all take the survey so that we can sort you all into at least your first or second preference choice for groups. If you don't opt into any of the groups or take the survey, then what we'll do is we'll randomly assign you to a session tomorrow. And I will talk more about that at the end. So Diana, are you ready to go?
I think so. Can you hear me now?
Yes, much better. If a few, I'm going to leave it up for folks. Can everyone hear? We don't need everyone to answer, but can a few folks let us know from the audience? Great, that's awesome. Thank you, Pedro. Thank you so much. Yeah, so go ahead, Diana, take it away.
Okay, next slide.
Yes, so thank you for that question, Rose. The breakout groups will be happening tomorrow from 9 a.m. to 12 p.m. we will be sending out a attendant survey for you all to fill out so that you can choose the breakout session that you would like to attend. So that will be the 4 focus areas that Ashley had laid out. So that will be eligibility for benefits and tax credits, public education, the role of employers, and asset building and limits. And so we will be sending out the link to take the pre-survey. We really highly recommend that you all take the survey so that we can sort you all into at least your first or second preference choice for groups. If you don't opt into any of the groups or take the survey, then what we'll do is we'll randomly assign you to a session tomorrow. And I will talk more about that at the end. So Diana, are you ready to go?
I think so. Can you hear me now?
Yes, much better. If a few, you know, I'm going to leave it up for folks. Can everyone hear? We don't need everyone to answer, but can a few folks let us know from the audience? Great, that's awesome. Thank you, Pedro. Thank you so much. Yeah. So go ahead, Diana, take it away.
Okay, next slide. Next slide. Next. So the official poverty measure doesn't vary by where one lives, by family composition, nor the new costs. Next. So the standard is an up-to-date measure of what income people need to be self-sufficient. So it's specific to what a particular family needs, given their family composition and where they live, and without any public or private assistance. We'll get to benefits later. Next. So the self-sufficiency standard is a bare bones budget. It's built from the ground up. It covers all the major needs for modern families where all adults live. Next. It varies by family composition, number of adults, and the age of children, because things like childcare and a little bit food, healthcare vary by age of a child, especially childcare. It also varies by place. The cost varies by where one lives. Manhattan, Kansas versus Manhattan, New York City. Next. So here are the market basket of goods that is in the self-sufficiency standard. We also add a little bit for miscellaneous. It's a percentage of everything else, and that covers things like clothing, personal needs, etc. Next. Whenever possible, the standard uses, to calculate the standard, whenever possible, the standard uses government-determined amounts that are enough to secure adequate housing, etc. Basically, it's what the government considers a minimum to secure, for example, housing. Fair market rents include housing and utilities, and that's the amount of people getting housing assistance. The same thing with childcare. The low-cost food budget from the USDA is enough to meet your nutritional needs, but it's only groceries, no takeout or restaurant food. Next. So the standard, lacking a publicly determined amount, the standard uses average expenditures. For example, for transportation, we don't have something equivalent to the USDA food budget. Then market basket costs are totaled, and then we add 10% for miscellaneous. Things like telephone, personal hygiene, etc. And finally, taxes and tax credits are calculated on the total costs using iterative formulas. So we add a certain amount, figure it out if that's the right amount, and then recalculate until we get the correct amount. Next. So here's what the monthly costs is as a percentage of the standard plus the amount of the standard for different families. And this is in Queens, New York in 2018, which is the last time we updated the standard for New York City. The last time for New York State was 2010, so 2018 is a little closer. So you can see how the expenses change to go from 1 adult to 2 adults, and then when you add infant and school-age child, suddenly you add that the light blue amount in the middle, 28% for child care. And that changes the percents of the other amounts, but you can see how much more. So that's a little over $7,000 a month in Queens, New York, for a family with 2 children, one under school age. Next. We take that same standard and then we relax the assumption of no public assistance or private assistance and look at what's the impact of adding benefits depending on where your income is from earnings. So in this case, you see over on the left-hand side, this is a percentage rather than dollar amounts. 100% is, for example, in the previous slide, that's a little over $7,000 a month. So we look at what percentage of the full self-sufficiency standard, that's being like a fully adequate wage, is at 100%. If it's less than that, that means the wage only covers so much. The wages are shown with the dashed line here. I hope everybody can see the line. And that's how much, with no supports at all, the wage is covered. So you can see that in the 2018 minimum wage, I think it's someplace in New York City, it covers about 48% of what you need to meet all your basic needs. That 48% of that, say, the $7,000. If you add child care assistance, just child care assistance, that adds maybe about 15%, and you're over 60% of what you need. You add food assistance, that adds a small amount, another 5%. If you get health care assistance, Medicaid, CHIP, that gets you up to almost 80%. And if you should get housing assistance, that's going to take you over 100%. And you can see as wages go up, so do the benefits go up. And then there comes a point about $24, $25 when you lose all of the benefits. There's a little bit of a bump here where you lose the child between $19 and $20 an hour. You lose food stamps, you lose the SNAP. And you can see that creates a little bump here as well as up there. One of the things I think we would do a little differently now is you can see that there's a line here that says 50% of HUD median income. This is the eligibility limit for getting housing assistance. In fact, for most people, because there's such limited amounts of housing assistance, most housing assistance is limited to people below 30% of median income, which would be somewhere down here. And so that housing number that cliff should be right there. In addition, relatively few people get housing assistance. The most common is to get SNAP and or child care assistance and or health care assistance. Getting that full package is pretty unusual. So you can see, again, going back up to about $24 to $25, you can see that the difference with the cliff occurs well before one gets to self-sufficiency from the wages alone. So you lose your benefits, and lose most of your benefits here, but you don't get to self-sufficiency without any benefits until 30 or so. So that's one of those gaps that we talked about earlier. Any questions? I will go on. We can come back. Next. So this set of slides is how the standard can be used. It can be used with clients to learn about local living costs and basic income needs. It also helps people to access benefits by determining eligibility and co-payment for benefits, and to strategize ways to self-sufficiency. One of the ways is with calculators. The example given here is for Washington State, but if you went to to this URL, you could play around with the calculator to see how it's used. Next. The self-sufficiency standard can be used as a tool for education, for financial planning, long-term goal setting, developing strategies and access and benefits. Next. It can be used for benchmarking and evaluation. So one of the ways in which it's used here in Washington State is that when people come into the workforce system, they do an assessment of where you are and then track what happens as you go through training and get jobs or increase your jobs. So you can benchmark the client's self-sufficiency standard progress. And then you can look at groups of people too, and you can evaluate the outcomes of a particular program. You can do so by gender, by race, ethnicity. In other words, looking at how effective different programs or different approaches are with different clients. Next. And the standard can also be used to, for strategic planning, for economic development, which is a more macro level, to help allocate funding. I think it's being used in southern Arizona right now, or in Arizona, for people to access funds under the COVID program. Next. And it is a tool for advocates. So it can be used to raise consciousness about the real cost of living. It can be used, as I think you were planning to do, to make the case for maintaining or improving safety net programs. And, for example, to make the case for living or minimum wage proposals, but again, showing what people really need versus what the minimum wage provides. As we saw earlier on the Cliffs graph, you can see that at the minimum wage, the standard shows that for a lot of families, you're only talking about covering 40%, or 45%, or 50% of what you need to meet your basic needs. So the standard can be used to help make a case for raising the minimum wage. It can also, again, using analysis such as in that wage adequacy graph, to make the case for maintaining and improving safety net programs in some of the ways you're talking about to address the cliffs, to address the various gaps. Next. And it can be used for researchers and analysts, people like us. So we take the standard and we code census data, and so we look at how many people are above and below and what are their characteristics. We address the questions of, is the problem lack of work, or is the problem lack of education? And one of the things we find is that among families whose incomes are below the standard, more than 4 out of 5 of those households have at least one worker, and often a full-time year-round worker. So the problem is much more wages. That's the kind of thing we can learn from that. We're also looking at health affordability by varying the standard by healthcare costs in a project in another state. Work support analysis is the kind we were doing with the Cliff analysis. And jobs analysis, which jobs pay self-sufficiency standard wages. Next. And also can be used for grant writing, as well as the advocacy. We talked about that in media. Next, please. Next. So one of the things that's included in the standard that I didn't talk about above is an emergency savings fund. And I think that might be of interest to those of you who are looking at some of the assets. And an emergency savings fund, which is an extra amount, it's not part of the standard, but it's provided in all of the tables, is the amount that a family of a given composition and given place must save for a time of unemployment. To calculate that, we found out how long people have a job for on average before there's job loss, and then the average amount of time that they're unemployed. And so we calculate what your living expenses are using the standard, subtract from that the average unemployment benefit, times the amount of time that one can expect to be unemployed, and that gives you the amount you need to save in emergency savings fund. And then we spread that out over the period of time. So if it's an average of 4 or 5 years before one loses a job, the average tenure in the job, you would save that amount of money over that. So that then tells you how much to save. And we have a larger sort of view that you need to have the emergency savings. First, you need to secure the standard, have enough income for that. Then the next thing is to create an emergency savings fund for any money once you've met your basic needs. And then finally is to think about choosing an economic security pathway, such as post-secondary education, improved housing, such as home ownership, or even just to get into secure housing if you're homeless. And finally, savings for retirement. Next. Next, so we talked about that. And this is the calculation for the emergency savings fund. Next. And that's it. So any questions? Glad to answer those.
We do have a question for you, Diana. One piece that we wanted to address, we had one question about the context of why we're talking about the self-sufficiency standard in relation to the benefits cliff. So why is the self-sufficiency standard an important part of this conversation? Why is it something we should be taking into consideration as we head into tomorrow and thinking about recommendations? One of the pieces I wanted to mention that we didn't have a chance to mention earlier is, and then Diana, you can jump in and add the technical side if you have additional pieces, is we are going to be, and this was mentioned in my slides, we're going to be working with the University of Washington not only on updating the standard for New York State, but we will also be modeling a number of the recommendations that we come out of tomorrow's breakout sessions with. So, and as we look at those 4 buckets that Ashley walked us through earlier today, there will be recommendations for each of those that we'll be working with Diana and her team to model. And what's exciting for us as advocates and policy wonks is that those models and some of the charts that Diana walked through earlier, the chart earlier where she talks about the different subsidies, and you can see the cliffs for each of those, we'll be able to model those not just at the state level and not just for New York City, but for every county across New York State. And for those of you who are advocates or who have spent time in Albany, you understand what a powerful tool that will be in our advocacy for our recommendations, because we will be able to walk into every legislator's office and be able to demonstrate to them what our recommendations will do for those that live in their communities, which is a really, really impactful advocacy tool. So I wanted to give some context to that as well, that the self-sufficiency standard is absolutely key in us being able to talk about what does it really take for individuals to live, not just in the country as a whole, not just New York State as a whole, but in their actual communities, because we know that's vastly different between New York City and the borough that you live in New York City as compared to upstate New York, in Buffalo, Syracuse, or Binghamton, or even smaller communities across the state. And so the fact that we will be able to use this analysis and the modeling of these recommendations we're going to be coming out of tomorrow with, to have that level of specificity in our advocacy, we think is really going to make the ensuing advocacy campaign just that much stronger. And we're very excited about that component.
To answer your question, back in the day, people used to do things like add the value of benefits to people's wages, and look, instead of $5 an hour or whatever it was then, they are actually getting $14 an hour. And it sounded like a lot to people, And what this does is say, wait a minute, how much do people actually need? So it contextualizes the value of those benefits. So instead of sounding like all of a sudden they're getting this huge wage that's higher than other people's wages, it says, no, actually, because they have children of this age, or they have this number of dependents that they need to support, and only this much income, this is how much the benefits get them to the point at which they can minimally meet at a minimally adequate level their benefits. So contextualizes it and makes sense of it, and also does so relative to the costs of people are facing in their particular community. So that doesn't. So in places like New York, especially New York City, where things are so expensive, it sounds like it's worth a lot. And people most people underestimate what the standard is. So they're really surprised to discover, that family in Queens is $7,000 a month. That sounds like really a lot of money. And it is a lot of money, but that's the minimum that people need. We're talking about housing at the fair market rent, which is what people getting housing assistance get housing. And food is just groceries. So it is a bare minimum. So that way you're contextualizing it. And that seems a much stronger argument for people when you're trying to present it to a legislator and say, this child care assistance, if you open it up in these ways, get rid of this cliff, that means this many more people will be able to minimally meet their basic needs and have adequate income.
Absolutely.
I do tend to avoid using the word because it has become, debase is quite the right word, but it's come to mean deprivation. The poverty line is so low that it's come to mean deprivation. So if anybody comes up with a better term, we use terms like adequate income, sufficient income, income enough to meet the basic needs, terms like that. And people understand that. We often do things like an exercise where people fill out a budget worksheet, and then they find out that they way underestimate childcare costs, or maybe if they have young children, tax costs, that kind of thing. It all adds up. People need to have all of that to meet their basic needs.
Absolutely, and that was something that was really powerful to us in learning more about the standard, is all of those components that go into that, that really are the reality for families, as opposed to, as you spoke about in the beginning of your presentation, the origin of the federal poverty line and how the realities of that have shifted dramatically in modern communities. And so the standard really does speak to those shifts and how we can be more responsive in our policy making. We did have a question about the need to discuss some of the policies and attitudes that have resulted in these types of policy creations. We are going to have those conversations in the breakout groups tomorrow. It's impossible for us to have a conversation about the types of recommendations we're going to be making without also talking about political context, both locally and nationally. And so that will be a component of tomorrow's conversations in our breakout group. So please do bring those questions to that as well. Just a quick question, Diana, how many other states do all states across the country have the self-sufficiency standard calculated?
We wish there was. It's 41 states that have the standard at this point.
Great. And when was the last time New York State was updated?
2010.
Great.
But New York City has updated in between. So 2018 was the last one. And all of the data is available at self-sufficiency-standard.org, as well as in New York City, I think the Women's Center website as well.
Excellent. And we'll put that link in the chat for folks as well to be able to access. Any additional questions that we have while we have Diana available?
United Way, I'm sorry. United Way. United Way. It's the one that did the last update for you as a series of these.
Okay. Well, at that point, Diana, I want to thank you for joining us today and taking us through that presentation. It will serve as a good foundation for our conversations tomorrow. And I will turn it back over to Zareen to lead us out.
Thank you so much, Diana, and thank you, Emily. We can move on to the next slide, please. So we are reaching the end of our time together, but I wanted to go through some next steps for today, and we will go through that. So next slide, please. So for tomorrow, we're going to start off with welcoming and opening the session out at 9 a.m. And again, please, if you are planning to attend a breakout session, please be here promptly so that we can close out the rooms at before we go into our breakout sessions. Then from 9:15 to about 10:30, we'll have our first breakout session. And we're going to switch up the itinerary a little bit because we're going to do the closing plenary from 10:30 to 10:40. And we wanted to recognize that, you know, we appreciate everyone's time, but some folks will not be available for the second breakout session. So we wanted to make sure there was a way to at least kind of leave us with closing thoughts as a group together. And then we will go into the second breakout session where so essentially from 9:15 to 10:30, you go into your first choice breakout session. And then for folks who have opted for a second session, they can go into their second choice at that point. That is, you know, highly ambitious, but we are hoping that the technology will work for us tomorrow. So the second breakout session will be from about 10:45 to 12. We'll have more information tomorrow about kind of how we're moving people around. Next slide, please. So wanted to leave you all with a couple of parting words before we kind of move on for the day. Essentially, in order, so please fill out the participant pre-survey again. I'm so sorry to plug this again, but by 1 p.m. Eastern Standard Time today, if you have not already done so. If you don't fill out the survey, we'll simply assign you randomly to a breakout session. So we would, so in order to avoid that, we would really like to match people up with the actual area of interest for them as well. So tomorrow we'll have everyone check their rosters in the beginning of the day for each breakout session, and please make sure you are in 2 unless you only signed up for 1 session. And please email me as soon as possible, or just reach out via chat to me if you come into the breakout session and do not see your name, but you had completed the survey. And again, we are going to be sending out supplementary short one-pagers for the eligibility for the benefits and tax credits, as well as the asset building and limits breakout sessions this afternoon. You know, these breakout these kind of one-pagers are really meant to be useful, handy references for the facilitated conversation. We'll also send out a separate Zoom link for tomorrow, this afternoon. And really, it's again because we're prioritizing you know, participant safety, that's kind of why we've been really sending links so close to the events. Yeah, I'm happy to take any other questions that folks might have. Let's see. We do have a question. Let's see. Yes, we will be putting a link to the chat. We'll be putting a link to the post survey in for you all. If there's any other questions, please don't hesitate to use the Q&A function or the chat function. Yeah, I'll leave it open for folks to bring the questions. Yeah, we will absolutely share the PowerPoints for the session for today. There's some really useful information in there. Any other questions? Again, please feel free to reach out to me with any questions or concerns you have. It's my email address is zamed@fpwa.org. And thank you all so much for being here with us. We really appreciate you, tuning in. And tomorrow, our hope is that we will really be able to have a fruitful discussion with all of you. The Zoom kind of box will look it will look like a meeting. It won't look like, it won't be this kind of webinar style. It'll actually be a meeting so that we'll be able to see and hear all of you and go into breakout sessions. So looking forward to tomorrow very much with all of you. And with that, have a lovely day, everyone. And Emily, if you want to say a few words.
Right, just wanted to thank all of you again, and thank you to New York Community Trust for being a sponsor of this event and this initiative. We couldn't have done this without you. So thank you, everyone, and see you tomorrow and our breakout groups. Have a wonderful day.
Thank you.